Hi, I'm Alex Howard, and I'm here with Sarah Marshall from the psychology team at the clinic.
Hi,
Sarah.
Alex.
And today we're going to be talking a little bit about how the Optimum Health Clinic approach on the psychology side is different to other things that are out there. One of the questions we get asked a lot by prospective patients is, how is what we do different compared to, for example, other treatments out there, things like reverse therapy, nickel therapy, the lightning process, EFT, CBT, and all these different kind of things that are there. And I guess, Sarah, as a starting point, perhaps what's worth us saying is that a lot of what we do is look at how all of these things fit together.
Yeah, I mean, I think that's one of our main strengths, and it's how we all work in the clinic, is looking at when a person comes into the clinic, we almost map out what brought them into kind of ME and their illness and what's keeping them stuck. And then we start to look at creating a map out of where they are through the journey of kind of healing and wellness. It's something that I think we excel at in the clinic, and something that I really enjoy doing, and I really enjoy working in that way.
Yeah, and obviously we've done previous videos, and there'll be future videos around some of these different areas, specifically around how we see these areas and how perhaps we differ in some of the perspectives. But I guess what we're really saying here is that every case is basically different, that there's not a one answer kind of solution for everyone that's affected by ME and chronic fatigue.
No, I mean, there's a lot of similarities, of course, but we do see everybody as an individual, and there'll be different reasons of why they got ME in the first place. There'll be a different stage of illness. There'll be different things that they need to do to start to move on from where they are. And there'll be different ways of them moving forward. So it is very much about seeing the person as a person and helping them to find their way out of ME and into recovery.
So I guess what we're really saying here is that it's a patient-centred rather than process-centred way of working, and that, you know, certain approaches that are out there, basically there's an approach and you fit into that.
Yeah, exactly.
And so, and I know that actually part of what attracted you to working at the clinic was that way of really working with the patient, because that's what you'd been doing by yourself. Why do you think that's so important to people? Because
there are, as you said, there's things out there that can work very well, but you have to fit it. So if you're having to find what you fit, then it's going to be quite difficult to recover. So what we kind of look at is how we can fit the techniques to the person. And I think it's just a really empowering way of working. It's about the person finding out what they need to do, and how they're going to kind of move out of that. So it's about empowering that person. It isn't about us, it's not about the technique, it's about that person finding what works for them.
Yeah, and of course some people, what they've got primarily going on is they've got, for example, a lot of anxiety, so they need to work at that level.
Yeah.
For other people, maybe there's a lot of suppressed emotions that are coming up that needs to be more worked at that level. For other people, it can be dealing with kind of their relationships with other people, or looking at some of their deeper psychological patterning that may also be there.
Yeah.
And I guess it's also worth saying that part of what we do, which is also quite different, is that rather than it being, you know, these are the tools, go off and use them, really supporting people along that path, and recognising that at different points on that path, different things may be appropriate for them.
Yeah, I use kind of my experience of coming through ME myself, and how at different stages different things can be very useful, and different things, as you said, you might be going through a period where emotions start to come up, you start to get more in touch with your needs and how they haven't been met. So it's looking at, as you say, working at that point.
And of course, if you've got a practitioner who is just looking, for example, the stress state or the anxiety side of it, then when emotions start to come up, often what happens is they'll just work with it in that way. And so the danger is the emotions start to come up, and actually they're just shut down because they're not seeing it from that perspective. And I know that in my experience of patients, I know that also you find this as well, that often there are stages to it. So it may be initially the first thing is just to calm down the stress response. Then it may be a case of really dealing with the underlying emotions that are starting to come up. Yeah. It might then be looking at how they're asking for support and getting support in their, you know, their home environment. Could be looking at then some of their achiever patterns, how they push themselves. Yeah. So there's all these different bits that need to be addressed at different points for people.
And even just nearing the end of recovery and looking at getting possibly a job or relationships or becoming a lot more independent, that in itself can be a stage that needs a lot of support, because going from being very ill and everything being geared up for that to having a life that's more independent and you going out there again, that in itself is quite an important stage.
Yeah, yes, that's a big phase, I think, for a lot of people. And I think it's probably also worth saying that part of what I feel very passionately about with both the psychology and nutrition team is that because of, I guess, our reputation and who we are, we're able to get the very best practitioners. And when someone's in treatment with a practitioner, they're really in treatment with a team of practitioners, assuming they've agreed on their questionnaire to their case being discussed within the team. So there's also a real benefit from working with the very best practitioners that are out there, but also them sharing their knowledge from the thousands of patients that have been treated through that. So people really are getting the benefit from that. And I know that you find that's also a really important part of the work.
Yes, and it's nice as a practitioner to have that support, because to work with such a complex condition as ME, as we know, there isn't just one answer. So to be able to share that with practitioners in the clinic and on the nutrition side, it's very much a team approach. So it isn't just me working with a client, there's a team of us. I might be the face of that team for that period of time, but it's very supportive both for me, for the client, and they get their best treatment that's out there.
Great. So for people that are watching this, thank you, Sarah, for your input as well. People watching this, really the next step is to, if you haven't already got an information pack, order an information pack, which you can get from www.freedomfromme.co.uk, or to book a free 15-minute chat where you can speak to Caroline, who's our new patient coordinator, or one of the people that work with her. And if appropriate, you can also speak with either Sarah or one of the psychology team or nutrition team about your case. And really that means we can find out specifically how what we're doing may be a benefit to you. So thanks for watching, and we look forward to talking with you again soon.